Well, the Western Cape is also experiencing a surge in coronavirus cases, but authorities say there are enough resources to respond to the increasing infections in the province. They're also aiming to administer 150,000 vaccines a week by the beginning of next month. Well, eNCA reporter Lindsay Dentlinger joins us now to discuss the province's readiness for the wave, as well as what goes into preparing for a COVID-19 wave. Lindsay, thank you so much for joining us. By all accounts, things right now are not looking quite as bleak in the Western Cape. It seems that we are a few weeks behind, and the roles have really reversed compared to Gauteng in the second wave.
Yes, Annika, that's a very important point you make there, and what health experts I've spoken to this morning want to point out in terms of making that comparison with Gauteng. As we know, they have over 8,000 new cases overnight. In the Western Cape, only around 1,100 new cases. And so they say perhaps a little bit unfair to say that the Western Cape is necessarily on top of their game, because we're in a very different point in that third wave. We saw the Western Cape reaching those other waves earlier than did other provinces, but in this case we are lagging behind. But by all accounts, Annika, we are seemingly well prepared for that third wave to hit in a more dramatic fashion than we've seen so far. You can see behind me here, I'm at a newly opened private vaccination site. It's just opened its doors this morning. It's at the Old Mutual Centre in Pinelands, and it's only accepting patients who have private medical aid, Annika, but they expect to be able to vaccinate at least 1,400 people a day. But what the challenge we are facing in the Western Cape right now is not getting as many vaccines as we can handle in terms of capacity of inoculating people. So in fact, this week we will see fewer vaccination sites operational compared to last week, because we are hitting all our targets in terms of vaccinating people. We're not just getting more vaccines, that we are able to inoculate more people, and so therefore some of these vaccination sites are not being able to operate to their full capacity.
Lindsay, why aren't we getting those vaccines?
Well, Annika, it's part of the national distribution system, the allocations made for the Western Cape. We're using them all up, Annika. In fact, we are even getting a few more vaccines than originally was scheduled for this province, because we are managing to hit our daily and our weekly targets in terms of using up the vaccines that are being allocated to the Western Cape. But as you know, it's a national problem trying to get more vaccines into the country, and the expectation was that at this point in the pandemic we would have had much greater stocks than we currently do, and so simply just not enough. And we know the Western Cape has from the very onset been saying that they want to, or they have been engaging privately with manufacturers to get more vaccines for this very reason. This was the expectation, that the vaccines were not going to roll in at the pace that originally we were told they would, and for all those reasons of the J&J vaccine being held up in the US. So just not enough vaccines coming into this province to meet the actual capacity for which these vaccination sites can actually operate, and the number of people that they could inoculate every day if there were more vaccines available.
eNCA senior reporter Lindsay Dentlinger at a private vaccination site at the Old Mutual Centre, and she makes the point that the Western Cape is not getting enough vaccines. We actually need more because we're reaching our vaccine targets. So that's unfortunate, and yeah, let's remember, everybody in the Western Cape, that we are a few weeks behind, so it's not the time to be complacent.